Ready to go? Welcome. Hello, I'm J. Stephen Morrison, joining you today as host of this 15th Asia Undercurrent webinar. I'm honored to be here to moderate today. The topic under discussion is boosting global health coverage, promoting international cooperation, and impact investment. We have a really sterling panel. I'll introduce them momentarily. If you're viewing live at the Nikkei channel or the YouTube live and you wish to submit a question, please scroll down to the submission link that's below. And we encourage you also to indicate your affiliation or title when you submit your question. This gathering here today is very timely for many reasons that we will cover in the course of the conversation. We will leave some time for those questions that you'll be submitting in the course of this hour and 15 minutes of conversation. I'm J. Stephen Morrison. I'm a Senior Vice President in Washington, D.C. at the Center for Strategic and International Studies, CSIS, where I direct the Global Health Policy Center. We have a major multi-year effort, the CSIS Bipartisan Alliance on Global Health Security, in which we do a lot of work on trying to promote, strengthen U.S.-Japan cooperation in health security. We'll be in Tokyo in the first quarter of next year for the launch of the CDC Regional Office for Asia, based in Tokyo, which we think is a great step. We've been very engaged in dialogue with the government of China around trying to promote a senior level dialogue between the two governments on preparing for the next pandemic. We have a very active podcast series called The Common Health, and I would encourage you all to subscribe to that and join us. And I'm hoping our guests today, we will enlist them to come on individually and post podcasts with us. When I said that it's very timely, there's been a lot of very active diplomacy around global health emanating from Asia in the course of this year. We had the G7 summit in Hiroshima. The Japanese government did a sterling job. It was a very highly impactful and important affair. There was just recently the completion of the Western Pacific region of WHO, its health summit in Manila, and it put forward a regional framework on pandemic preparedness and response, and drew our attention to many of these continued issues that concern us around infectious diseases, antimicrobial resistance, extreme weather and other expressions of climate change, pollution, and enduring inequality in terms of access and capacity across Asia. We know that COVID struck this region very forcefully, as it did the rest of the world. The economic setbacks somewhere in the order of 3.4% of GDP loss. We know that extreme poverty within Asia climbed significantly from an estimated 68 million pre-pandemic to about 155 million, a little under 4% of the total population of this region of 1.9 billion people across 37 different countries. We know that there's a great concern, and we'll talk more about this, around aging, which is a particularly important issue and topic, complicated topic within Asia. It's a slow crisis that's been building for a long time, that's much more visibly being discussed right now in terms of the impact on sustainability of healthcare, the demands in terms of mental health and treatment of dementia, the economic consequences of that. We also know that pollution is a high topic. Of the 3/4 of the world's populations that are most impacted by pollution are in Asia, most of them, Bangladesh, Indonesia, India, Pakistan, China. There's been very significant gains in China in this case, but we still have a very serious concern there. Let me now turn to our guests, and I'm going to introduce all three of these remarkable people who have joined us and then ask them to speak, each with 6 minutes of opening remarks. They've put a lot of effort into thinking carefully around what they want to say, so we'll move through those. stay with me for a moment while I just go through quick biographic introductions of our guests in the order in which they will be speaking. Our first is Professor Yik-Ying Teo, who we'll refer to as YY. He's the dean of the Saw Sway Hock School of Public Health at the National University of Singapore. He's also the vice president there for global health, very deeply involved in the World Health Summit in Berlin, in the PMAC in Thailand. Started a career in genetic technologies around applications on tuberculosis and malaria, received his BS at Imperial College in London and his master's and PhD at the University of Oxford. Our second speaker is Madam Sachiko Imoto from JICA. She's a senior vice president at the Japan International Cooperation Agency, where she has lead responsibilities on East and Central Asia, on the Caucasus, on economic development and human security. She has a special focus on strategic partnerships. She was just most recently in Ethiopia, engaging with the Africa CDC. We had the honor of hosting her earlier this year at CSIS for a discussion around the lead up to Hiroshima and the G7 summit, and had the honor of her at one of our big events, but also a podcast, which I'd encourage you to listen to. She has a bachelor's degree and a master's of public affairs from the International Christian University in Tokyo. Our third speaker is Ken Shibusawa. He founded his company, Shibusawa and Company, in 2001. He founded a mutual fund, Common Assets, 2008. He's a senior advisor, Brunswick Group, and for the last 2 years, and is an expert on impact investing. He is a member of Prime Minister Kishida's Council on New Capitalism, which is an important development. We'll hear some from him on that. He too started a podcast series during COVID, which is an interesting connection, and a graduate of University of Texas, Austin, and the School of Business at University of California in Los Angeles. So welcome to all of you. It's a real honor to be together with you today. So let's start. We'll hear from YY first, then we'll move to Madam Sachiko Imoto, and then to Ken Shibusawa. Over to you, YY.
Thank you very much, Steve. So very helpful introduction that you've given about myself. So I am looking after global health at the National University of Singapore. And one of the things that we believe strongly when we work in the area of global health is actually the importance of academic government partnerships, because we believe that actually academia holds quite a lot of a sustainable lens towards global health, sometimes much more sustainable than rapidly changing priorities that are linked to rapidly shifting political parties. But I think today I will start off my opening remarks really focusing on some of the contemporary global threats that threatens the health of populations. And earlier on, Steve, you talk about some of the megatrends, because you mentioned changing population demography that is driving increase in longevity. And of course, that results in a destabilizing of traditional healthcare financing systems while rapidly increasing the burden of non-communicable diseases such as diabetes, hypertension, cancers. This is a major mega trend that is going to threaten many parts of the world. And of course, we also see rapid urbanizations of countries that indirectly as well as directly result in what you mentioned earlier on in your opening remarks, which is changes in climate. And let's not forget another major mega trend that is driving a lot of the threats to health, which is because of geopolitical tensions. We have seen in many parts, including Southeast Asia, in Myanmar, including what's happening in Ukraine, in Palestine, even the ongoing tension between China and USA. This directly and indirectly increases the complexity in the health landscape. I think, and one other final megatrend that I'll talk about, it's really this increasing distrust in state actors, in government, in NGOs, that are coupled with the rise of disinformation and misinformation that is spread through social media. We have seen how damaging that has been during COVID-19 in rising the degree of distrust against vaccination. So I think within this world that we are looking at in the 21st century, it is much more complex. The global health landscape is much harder to navigate. I talk about some of these problems of aging population. Imagine the double burden of aging population that drives rising prevalence of NCDs that is set within the pandemic era. This is where we are. The world is now within the pandemic era. And from COVID-19, we have already seen that the greatest health burden of outbreaks, whether it is local or it escalates to become a pandemic, actually threatens people with underlying chronic diseases even more. So that is actually the scene that we are looking at. And I think when we start to think about how local health systems, this is when we have to admit very candidly that traditional models of health systems that focus primarily on providing acute tertiary hospital care, this has failed. Because firstly, it is expensive, it is reactive, and it is typically so specialized that it doesn't really address some of the root causes of diseases and poor health, including some of the socio-economic factors. I think many parts of the world, particularly in advanced economies, have started medicalizing health. And to that extent, we tend to forget that there are social determinants of health, environmental determinants of health, and those are very important for us to discuss. So I think there is a crucial need for us to start thinking about redefining what population health is. How do we maintain population health, especially in relation to social determinants and environmental determinants of health, rather than just having a medicalized approach towards health? And I would highlight again that this is not going to be sustainable even for the wealthy countries. Let's come back now to Asia. Asia is actually a very diverse continent. We have advanced economies, which includes Japan, Singapore, where I'm from, South Korea, but equally, we have quite a considerable degree of developing countries, which World Bank conventionally defines as low and middle income countries. So the health challenges of advanced economies and some of these LMICs can be very different, but the solutions have to also equally respect that context specificity, that what works in a wealthy country may not necessarily work just as well. But I think it's important at this point to highlight some of the commonalities and differences. The common principles, such as providing the necessary financial safety nets for health through universal health coverage, investing in primary healthcare, focusing on health promotion, preparing the country, the local systems well for pandemic, all of these are common principles that will be critical regardless of the income status of the people or the country. I think the boundaries between rich and poor countries, or even rich and poor districts, because of migration, rapid urbanization, actually is starting to blur because of this this mega trend of rapid urbanization as well as climate change. I suspect climate change is going to result in quite a significant degree of forced or even voluntary migration of people, and governments need to adapt as well as adopt actually an equity lens really towards looking after the health of migrants. Now, one area that I will highlight that it's clearly still segregating between the well-resourced and less well-resourced countries is actually the issue of chronic and dire shortage of trained human resource for health or healthcare professionals. And I think this will worsen the problem of health inequity across Asia. WHO currently has a global code of practice on the international recruitment of health personnel, but the ground situation that is faced in a number of low and middle income countries continue to point to a dire shortage of HRH, the human resource for health. So I think one of the dominant themes for tonight, perhaps Steve, we look forward to the discussion, is really around how local governments can be incentivized and supported to strengthen their local health systems, not just to tackle some of the key challenges that we talk about around access, quality, sustainability, affordability, but also in relation to training and retaining the local workforce that will be fundamental backbone for any health system. And I think this is where some of the themes tonight around partnerships, especially with governments, subnational or national, as well as innovative financing beyond the development assistance funding may be something we would explore further. So over back to you, Steve.
Thank you so much, Professor Teo. That was a brilliant tour d'horizon. You've painted the landscape very, very powerfully and very comprehensively in a matter of just 6 minutes, which is quite remarkable. Our next speaker is Madam Sachiko Imoto from JICA. Sachiko, great to see you. Thank you so much for being with us. The floor is over to you.
Thank you, Steve. Thank you. I'm so pleased to be here. So against the very holistic view of YY, I would like to present some of the observation that we acquired on the ground, because JICA works with cooperation with partner countries in Asia. Over the years, JICA has had 3 main pillars in the cooperation in the health sector. One is strengthening of hospitals and the referral system. And second is infectious disease control. And the third is maternal and child health care. And in hospitals and referral systems, one of the good examples is Vietnam, that we supported the 3 tertiary hospitals, strengthened subordinate hospitals, and constructed the regional hospitals, and made the referral system from the primary to tertiary care would work. And for example, in infectious diseases, we often strengthen the laboratory network or surveillance system in our partner countries. And for maternal and child health care, one of the good example is that we support introduction of the maternal and child health handbook in Indonesia, or human resource development in maternal and child health care in Cambodia. And in fiscal year 2022, JICA spent roughly $37 million in health sector in Asia for technical cooperation alone. So, but now we have, and we observed certain achievements in areas, for example, like maternal and child health. But in recent years, there is an increased need to address non-communicable diseases and aging of the society, which is progressing in Asian countries as well. In addition to the financial burden caused by aging of the society, such as increased medical costs, society as a whole will need to respond to a variety of factors of aging society. As Japan faces challenges posed by NCDs and aging society ahead of the rest of the ASEAN countries, there's a high expectation among ASEAN countries to learn from Japan's experience and share the knowledge. So JICA is now tackling the challenges of NCDs in countries like Sri Lanka, Uzbekistan, Cambodia, and India, and for aging society in Thailand and Sri Lanka. And in some of these countries, we used to work in maternal and child health, but now we have made transition to our support to NCDs. And in terms of infectious diseases, Southeast Asia's experience with emerging and re-emerging of infectious diseases, it poses an international challenge. With the aim of strengthening cooperation among countries in the region, it's very, very important. So joint research on infectious diseases between research institutions from partner countries and Japan and regional cooperation have been active in ASEAN countries. And we will continue this trend. And talking about the pandemic revealed the world is facing 3 critical challenges. The one is national boundary. Insufficient information disclosure from outbreak countries show confidence in the international framework. The second, lack of solidarity. While effective vaccines were developed at an unprecedented speed, their speed to spread to low and middle income countries was delayed, shaking confidence in international solidarity and equity. And third, information overflow. A great deal of information without scientific basis flooded the societies, shaking trust in science and experts. So in order to overcome these challenges, the international health architecture needs to be reconstructed. One of the proposed mechanisms is a MCM delivery partnership endorsed in the G7 Hiroshima summit. This is to ensure equitable access to essential medical supplies. And in order to make this international architecture work in the crisis, local architecture, which is national health systems, must be strengthened in parallel. Until a vaccine is developed, it is necessary to prevent the spread of the disease by other means, such as sharing accurate information, promoting hygiene behaviors, strengthening surveillance, quarantine, and so on and so on. And this is done by national health system. And the fact that JICA's partner countries in many developing countries area took charge, our partner organization, charge of their country's pandemic response, that we can see good example in Vietnam, and made it possible to control pandemic is proof of this. And human resource development through years of cooperation played a central role in this pandemic response. It is also an important lesson that the economic status of countries was not the sole factor. In some high-income countries with ample resources, countermeasures did not work well, while some low-income countries such as Vietnam controlled the situation relatively well. So it indicates the strong need for countries to work tirelessly toward the realization of universal health coverage and functioning health system, including domestic resource for recurrent costs. And for the new financial mechanism, in response to the pandemic, the World Bank established Pandemic Fund through discussions at the G20 and began providing grant funding. And this funding is responsible for funding the PP portion of the PPR. And the G7 Hiroshima Summit agreed on three-tier approach, strengthening domestic financial mobilization, strengthening financial mobilization through existing international frameworks, and establishing a new international financial mobilization framework, which is involved in this impact investment. And JICA has been also active in supplying our funding to the prevention and preparedness. And we are going to work together with our partners. And how to provide service to the poorest and most vulnerable is a challenge. So appropriate burden sharing between public and private sector, providing right incentives to private sector. And this kind of design is necessary to promote universal health coverage. Thank you.
Thank you so much. It's been such a busy, active year for your government, for your agency, for many of us. We'll talk more about that, but congratulations. I mean, the level of intense engagement around universal health coverage has been remarkable this year. This has been an enormous year to see that agenda item, which the Japanese government has pushed now for several decades as a priority in its global health strategy. We're seeing the fruits of that very dramatically. It's very important. It's moved, I think the Japanese government's efforts have actually moved Washington significantly in the right direction on that. And you deserve significant credit for laying the groundwork and really the stamina, the perseverance over years in developing that agenda. Our third speaker, so congratulations. Our third speaker is Ken Shibusawa. I've given you his quick bio. Over to you, Ken. Floor is yours.
Thank you very much, Steve. Good evening, good afternoon, good morning to everybody who's joining us tonight. Very honored to join this distinguished panel of experts in global health. As Steve mentioned, I think global health has been the cornerstone of Japan's foreign policy for at least the last 2 decades. It's all about human security, and especially these days, even after post-COVID, human security is a very, very important, pertinent topic at present. I am not a global health expert, but I have been involved in global health for about the last 10 years or so. About 10 years ago, I had the honor of serving the Friends of Global Fund here in Japan, the director of that, and hence my involvement with global health back then. But my discipline is asset management, investments. And so I think I bring to the table in the discussion tonight is that perspective. Even from 10 years ago, I would hear words like innovating financing mechanism. which is a very fancy word. To me, it sounded like, well, we need more private sector money. And the private sector plays a very important role, obviously, in global health. But if you're looking for financing from corporations or investors, there are assistance money from them, but the budget tends to be very limited. For me, from where I stand, for serious money to come into global health from the private sector, from the corporate sector, from the investment sector, is to make sure that there are areas in global health that you can say, actually, this is a growth strategy for new industry. People think about the costs in healthcare. Yes, but cost to somebody is sales to somebody else. So somebody has to is making money there. The concept of impact investing. I've been a follower of impact investing since its inception about a little bit over 15 years ago. And to me, that brings in a new discipline. In a sense, this is a part of the new form of capitalism that Prime Minister Kishida is promoting. People don't really understand what that means. But from where I stand as a council member, I believe what he's trying to say is he's not denying capitalism, but he wants to incorporate externalities being left behind by capitalism, which is obviously the environment and society. And to do that, in the paper that we drafted for the new form of capitalism, June of last year, basically outlined what impact investing was. And basically it's investing, so you're talking about risk return, so you're not giving up that. But this concept of impact is you're adding a third dimension in plus the two-dimensional risk and return. That third dimension is actually providing solutions to the environment and society. But it's not just doing good, but it's actually being able to measure and set goals, and that's the intent for impact. That's the important message. We were able to get that into the new form of capitalism paper recommendations. And over the last year, I had the assignment of trying to get at least 1 or 2 lines into the G7 communique in May to have this concept of impact investing. We were successful thanks to the hard work of the Secretariat and many other people. I thought mission accomplished, this is fine. But they said, well, no, we have to actually launch this. And so in September, during the UNGA week, as a side event, we had a very, very high level launch event with the Prime Minister attending, Bill Gates, Secretary General Tedros from the WHO. And we were able to launch this initiative called III for Global Health, which is Impact Investment Initiative. I'm one of the co-heads. We have 2 other co-heads. One is Steve Davis, former CEO of PATH. Very, very smart, intelligent person. We also have Yodi Alakija from Nigeria. Very, very passionate, energetic. So we have wonderful co-partners, 3 co-heads, supported by a team of the knowledge implementation partners. We have advocacy partners, and we were able to get, despite a very, very short time frame, we got 38 corporations and investors that said, hey, this sounds like a very interesting idea, let's get on board. And so the G7 process, from where I stand, is very, very complex, but at the same time, the convening power of the G7 is very, very, very impressive. With that convening power, we hope to have a place where practitioners, investors, corporations can share best practices of not just doing good, as I mentioned, but having impact in global health. Now, we're not going to answer every aspects of global health through investments, because obviously there are areas that just won't generate financial returns. But I believe there are pockets or slots within the global health value chain where the private sector can play in terms of delivery, logistics, drug development, where the private sector can play a role in terms of involvement in global health as a growth strategy, in addition to, quote, doing good. So back to you, Steve.
Thank you so much, Ken. That's really quite exciting, and it's another piece of powerful evidence around the significance of the G7 in this period in time. I mean, the G7 prior to the Russian invasion of Ukraine, there was an open question around the credibility and strength of the G7 as an operating entity. It's been elevated dramatically, and its impacts diversified, its engagement. If you look at that Hiroshima communique, it's super impressive in terms of the specificity of the goals laid out. And so congratulations to you. Let's have a conversation for the next 20 or 30 minutes. We'll bring in some questions from our audience towards the end. We're going up until 1/4 the hour. Let's start with a question around what is it that distinguishes Asia as a region. As I mentioned earlier, almost 2 billion people, 37 countries, and we've heard about some of the issues that are very prevalent in terms of the divisions between highly advanced versus low and middle income, the issues around chronic diseases, NCDs, and aging, the questions around pollution, but what I'd like to do is turn things around a bit and ask each of you to reflect, what is it that are the special attributes of that Asia brings forward that we should be highlighting in our thinking around this region? And what I mean by that is it a question of exceptional capabilities in certain areas, and what would those be? Is it strength and focus of the private sector? Is it the consensus that exists around things like universal health coverage? Is it forms of leadership that we're seeing within the region and across the regional bodies? There's many different angles, but I don't want to speak for you. I'd like you all to each sort of share with us when you look at this region and you think, yes, profound megatrends, as YY has laid out, profound challenges that are emerging, urbanization, climate change, but also strengths, exceptional strengths and assets here. And let's talk for a few minutes about what those are. I'm going to ask Sachiko to open that piece and then come to YY and Ken. Sachiko?
Thank you very much. As you also mentioned that Asia is very diverse. But I think we have really made tremendous achievements in the past 50 years, if we look back the trend. And one of the strengths that ASEAN countries had is its continuity in investment, especially in human resource development. Each country really tried very hard to have a good human resource, especially in a primary level. And they kept investing in, maybe not enough, but still, they continue this investment in primary healthcare, especially human resource development. And now each country has gained their own experiences and now widening their scope to the regional cooperation. So until now, we have been working with each individual country, but now there's this trend coming out that as the ASEAN region, the countries in regional cooperation should be strengthened, sharing the knowledge and experiences together. This continuity and the integrity as a region is the strength that Asia, maybe South Asia is a bit different, but ASEAN as a whole, I think this can be the strength of the region. Thank you.
Thank you. YY, your thoughts on what are the special attributes or assets of this region that we need to keep in mind as we're thinking about dealing with these megatrends and threats?
Thanks, Steve. And Thanks, Madam Imoto, for your sharing your views on the human resource development. And I'll just add very quickly on the human resource development part. I agree completely, because if we look at Asia, and I will highlight a few countries: Indonesia, India, Laos, Cambodia, China, South Korea, Japan, Singapore. These are countries that spend an enormous amount of the national budget in trying to ramp up the education level, the well-being level of the people, of the populations. And that is it's reflected in how fast development in countries like Indonesia, in Laos and Cambodia. You can see that development happening within years, within decades. And I think Madam Imoto is absolutely right that in Asia, there is this very pragmatic lens towards, let's get the necessary things done and identify what needs to be done, and let's do it. And I would use COVID-19 to highlight this cultural view, because I think in the early parts of 2020 and 2021, where we still didn't have effective vaccines to protect against the population, you will notice that in East Asia and in Southeast Asia, quite a number of countries actually did very well to protect its population. And I think there is that sense of communal benefit and overall well-being for the whole population and community, rather than that individual chase for freedom. I think that in itself is an asset in Asia. The second point I wanted to raise is around wealth, because in Asia, there is a tremendous amount of wealth that is being generated in a number of countries. I talk about China, I talk about Indonesia. These are countries that are progressing very fast. And how do we mobilize that wealth to actually benefit? We talk about universal health coverage. Are governments having the right lens to leverage on the wealth that is generated as part of their GDP, or even part of private financing that Ken talked about, and how to mobilize this for strengthening health systems? And the last point is on technology. Asia, again, I talk about China, Japan, South Korea, Singapore, curating, producing a lot of technology, particularly in health, not just in healthcare, but including in health promotion, maintaining health, and even innovative ideas around health security. And I think those would be the 3 points that I'll highlight, that perhaps Asia does have those opportunities, but how do we mobilize and direct governments on the right agenda setting? That would be a crucial aspect. Back to you.
Thank you so much, YY. Ken, how do you see things in the region in terms of its exceptional attributes?
Sure. In addition to everything my colleagues said, well, population, right? I mean, Asia is, I mean, there's no one Asia. It's very diverse. But if you look at Asia, there's massive population. So what does that mean? Well, that means there's a huge amount of human capital potential. And to be able to empower, to be able to capitalize on that human capital, well, you need help. You need help. So I think that's what Asia brings to the table in global health. But I think it's very important for Asia to not just think about Asia. Because if you think about it, there are a lot of other places around the world in the so-called global south. Africa, which will be growing faster than Asia in the next 30 years. Latin America. And for them, how do they see Asia? I think for them, they see Asia as somewhere that there was non-European, non-American, but being able to be prosperous. And how is that based? It was based on basic good health. That's one, and based on human capital. And so in a sense, I think Asia, Asia brings is actually a role model, a case study for other so-called LIMCs outside the region in Africa and Latin America as well. And so for me, that is one role that I think Asia should be thinking about as we're getting into this world that's very, very complex and very, very challenging.
I want to bring back the question of preparedness for dangerous pathogens that appear. Now, before the coronavirus struck in early 2020, became apparent early 2020, there was an index that assessed all of the world's governments as in terms of their readiness, their preparedness. And that was done by the Nuclear Threat Initiative here in Washington, D.C. And the United States was ranked as the first in preparedness. When the pandemic struck, in fact, our performance as a country was woeful in many, many ways. And people scratched their heads and said, what did we miss here? Wait a second. We were very poorly prepared, and many countries in Asia were quite well prepared and performed quite well, and had a much stronger national consensus and investment in the long-range preparation of those capacities needed, while we were tearing ourselves apart debating many of the interventions and strategies that became highly politicized here. What is it in terms of historical experience? Is it the result of this earlier SARS outbreak? Is it the result of other infectious disease outbreaks? What is it that gave a greater resilience and level of preparedness to many Asian countries when COVID did appear? Why? Do you care to say anything on that?
Well, I could spend a long time discussing the catastrophic failure of that global health security benchmarking, but I don't think we have enough time for that. But I would just highlight that indeed, that benchmarking in itself was completely flawed. Even the basis that they did the benchmarking was wrong. So I think there were very critical elements of pandemic readiness and preparedness that has to do with governance, that has to do with leadership, that has to do with even how communities are ready as a community to respond. It goes beyond just government drawer plans of what to do. And I think coming back to Asia, I would say that to some extent, SARS, MERS that happened in South Korea actually did leave a significant footprint and legacy in Asia in terms of preparing and requiring countries to develop the necessary drawer plans. If an outbreak happens, what would be necessary? This certainly was the case for countries that I'm aware of, like such as Singapore, territories like Hong Kong. They had very well-developed plans on it. But I think I'll come back to the bit about the culture, because I mentioned the culture earlier on. This culture of community before self, it's very predominant and prevalent in Asia. We talk about some of the countries that have done very well, including Vietnam, including Japan, Singapore. Issues such as wearing masks was never, ever necessary to debate publicly. People just naturally realize that, well, there's an outbreak. Personal responsibility, I will minimize the risk. And of course, we have seen how a very simple act of wearing masks can tremendously reduce the reproductive number for COVID-19. And that helped Asia, many parts of Asia actually manage well. I think that cultural aspect is a real value in many Asian societies that help governments manage. And I think I'll just finish on the point on trust. In Asia, there is still quite a lot of respect and trust for governmental leaders. It is coming down, regrettably, with a lot of social media problems. But I think comparative to the rest of the world in Asia, that respect and trust is still very important when it comes to a health crisis. And I think earlier on, Steve, you highlighted antimicrobial resistance. You talk about threats of climate, pandemics, including the rise of NCDs. In Asia, I still believe firmly that government actually has it much better in addressing some of these global threats to global health than Western counterparts. So I'll just leave it.
Thank you. Thank you very much. Sachiko, your thoughts?
Actually, YY has mentioned what I really had to say. I do think that MERS, SARS, those experiences really played a role. It's similar in Africa. They also faced a lot of pandemics before, like Ebola, and we could see that actually not as much as we were afraid that Africa quite managed the situation well. So the past experience really played well. And also, as YY mentioned, I do see that many people here in the region have trust in the system, maybe leadership also, but also our health system. I mean, there might be some problems, or we need some reforms in some extent. But in basic, our health system is still functioning, and we do have these periodical vaccinations and so on, so on, so on. So a lot of people actually could trust how the system, the health system, and how the government deliver the message and provide the services that we should be relying on. We could really naturally follow that path. So that trust in the system itself is quite important. Thank you.
Thank you very much. Thank you much. Ken, your thought?
I can only speak for Japan because I was only in Japan during the COVID crisis. Japan was not prepared. We were not prepared. But how do we manage? Just common sense. Just what I mentioned, just what Sachiko-san mentioned. Wear masks, stay away from crowds, and trust in the government. That's a question mark. I'm sorry, I'm not in the government. So, but there is a sort of demands on the government to get things in shape, and there is this sense of conformity, I guess, when there are directives. And so might be a little bit different from trust, but I think just common sense. That's what probably, from my perspective, what happened in Japan.
Okay, let's shift our conversation a bit. I want to talk about the broader geopolitical environment that we face today. As a globe, we're in a particularly fraught moment. We've seen the dramatic intensification of tensions between the U.S. and China and much of the rest of the world. But we've seen the two most powerful countries in the world, their strategic confrontation intensifying in ways that have people very on edge. We'll see what happens at the APEC summit in San Francisco in mid-November. Where it's hoped that the two presidents will join together and that there will be agreement to reset some aspects of the relationship. There's been an effort in recent months to sort of lay the groundwork for that. We now have, of course, the war in Ukraine. It's becoming clear, a war of attrition, a long-term war, the consequences, enormous costs across the board, and we're seeing the projection of impacts into the global south in terms of food insecurity, debt distress, inflation, other factors, where the global south is bearing a burden as a sort of a consequence of this massive ground war, the first major ground war in Europe in 70 years. And now we have the war in the Middle East, which is just in the last few days, 1,400 civilians, 1,000 civilians and 300 members of the Israeli Defense Forces murdered on the border of Gaza. Now we have thousands of Palestinians who've passed or been injured, the highest level of loss by both Israel and Palestine in 50 years. And that's shocking, and we're not out of that yet. For clearly that, and we could talk about other things, but we are in a moment that's very fraught geopolitically, that has people on edge, very on edge. And so, one question is the agenda we're talking about here of international cooperation, of private sector deeper engagement in global health, of solidarity, of organizing around some of these common themes of universal health coverage as a fundamental aspect of global health strategies. How do we keep that alive? How do you sustain that agenda in this environment right now? I mean, obviously, diplomatic strategy becomes very important. The fora we've talked about, G7, G20, ASEAN, other entities become very important. I'm going to turn to Ken first to help us think about this a bit. I know you're not a diplomat. I know you're not a health security person, but you're a big thinker and you're coming at this from the private sector aspect. So let's start with you, Ken, and then go to Sachiko and back to YY. Thank you.
Okay. Well, thank you, Steve. You caught me off guard there, but
well, it's okay.
no. To me, I think I go back to my comments, the last question. It's just common sense that life is precious. I mean, I don't want to see babies dying in Israel or Palestine. I want to see old people in Palestine or Ukraine or Israel living out their full lives. I mean, it's just common sense. So I think, to me, if just people would just think about the common sense of how precious life is, I think, unless we lose the perspective of that and it gets very political, we'll never get out of this. And so,
Thank you. Sachiko.
We are really struggling to secure our engagement and fund for promotion of global health, given the pressure that we really need to do more for Ukraine or other conflicts or international lots of crises. But as Ken-san said, the life is precious. It's a common sense, and that can also involve many people outside of government, not only the government. Of course, the governments need to play the role, but also we can line up together with other stakeholders, civil societies, private sector companies, because the health of the need of the investment in health is rather, for us, it's our problem. Not like a high, diplomatic tensions. It's our common interest that we would like to have a healthy society for everybody. So in a sense, it's very difficult to keep momentum in this facing so much multiple crises. But at the same time, I see that it's one of the large opportunity to widen the support from the other actors, non-state actors in the health sector. So, talking about the reality and the needs of long-term investment in health, it really needs a long-term investment to secure human resources and to have the basic status of nutrition and so on and so on. So, we really need to talk with many different actors, not only the government or not only with the international organizations, but with the citizens, civil societies, NGOs, academics or private sectors. And this can be the area that we can really talk on the common ground. So I would like to see the widening support base from those non-state actors in the health promotion of the universal health coverage. Yes, back to you.
Thank you so much. Thank you. Why? Your thoughts? How do we deal with this exceptional moment that we're in? Dangerous moment.
Thanks, Steve. So I think we have to first start off by saying that this is a catastrophic shock to any health system. And we could talk about universal health coverage, we could talk about primary healthcare, but the reality is that in a situation like Palestine, the entire health system has completely disappeared. So that's the reality. So in that particular situation, what we're talking about is really humanitarian assistance that has to go in very rapidly. We are talking about very simple fundamentals like water, food security, access to essential medical supplies. And that brings it with it, of course, the necessary complexity. But I think one element that would be worth highlighting today, especially in global health, is around forced migration. And neighboring countries have been trying to accept some of these incoming refugees. And these neighboring countries, that is where I highlighted a bit about how geopolitical tension is going to change our lens towards what we define as equity, because equity now has to extend to incoming refugees. But the problem is, how would a responsible government actually tap on their scarce healthcare financing to extend aid to incoming refugees without compromising on what they have promised for their own local people? This is where the international cooperation must come in to address some of the needs to support neighboring countries that are willing and ready to accept incoming refugees. After, of course, the crisis, that's where we start thinking about the rebuilding. And that's a separate scale of the problems that we have. But I think at this moment, it is important for us to acknowledge that very fundamental concepts of universal health coverage or even primary healthcare has completely disappeared because of the catastrophic shock to the entire health system.
Thank you. Well, I really was grabbed by Ken's comment that life is precious and this is common sense. And beginning from that point sort of brings us back to a kind of fundamental value that I kind of interpret that those sets of remarks that you've all brought forward is it comes back to shared values. It comes back to reminding people in the midst of crises of what the shared values are that have to continue to drive and guide engagement internationally and globally. We have a couple of questions from our audience. I want to turn to Ken. There's one specific to you, Ken, which is around the issue of equity and how, if the private sector is moving forward as you're advancing, as you're espousing in terms of impact investing, how do we make sure that there's equity in the impacts? Because there is obviously what you've outlined is a sense of ethical obligation around society, around vulnerable populations, around bringing broader benefits. Talk a bit, Ken, about how do you put guardrails in, or how do you approach this in order to demonstrate a seriousness of purpose with respect to equity?
That's a very important and good question. I don't think there's a simple answer to that, because as I mentioned, the global health value chain is very, very complex, and there's many, many stakeholders in it. There will be people that will be left out because of the impact investing is investing for profit, and in that respect, that'll leave out some people. That's obvious. But my hope is that within that ecosystem of people trying to figure out what the right answer is, and that will come to the conclusion about equity. I mean, if we leave it up to the government to figure out what equity is, that's not going to happen, because the fact that I think if you just leave it up to the government, things like wars and ugly things like that happen. So it's just, again, I'm sorry to be so, in a sense, idealistic, but you have to go back to the common sense that we're trying to do the right things here. And if there is a problem about equity not being delivered to some aspect of the population because of this, but because of that part is starting to move, maybe that part will sort of, it becomes, what's the right word for it in English? It's more of a organic sort of a ecosystem, I think. Because if you try to do equity in just sort of this very mechanical, model-driven platform, that you always be leaving out somebody behind, or there'll always be somebody that is very, very unhappy because they feel that equity is going to the other party and not mine. And so to me, I'm a market guy, because I'm in the of investing, and markets are very imperfect. But it's very imperfect, but there's a sense of trial and error, trying to find the right answer, the right price for that value. And to me, the equity part of the equation has to have that kind of dynamic in it. And it's not so rigid. It's more organic in terms of, trying to reach that point.
Thank you. Thank you. We have two questions that are very pertinent to Madam Imoto. First question is, how do you strengthen research exchanges across the ASEAN member states? How does Japan do this, approach this, in order to respond to the challenges, the emerging challenges of aging societies, infectious disease, and the like? What is the strategy from a JICA standpoint in getting these research exchanges moving forward across ASEAN countries? The second question we've touched on a little bit, which is we're in a moment globally of massively escalating humanitarian emergency demands. And how do we protect in this period? How do we make sure that we're responding to that while at the same time continuing to work long-term on the sorts of investments that are going to still remain essential looking forward? Over to you, Sachiko.
Thank you, Steve. In order to establish the the partnership for the research, human network, and the past trust or experience together is very, very important. So the past over 50 years, JICA has been supporting research institutes in many ASEAN countries. And also we have been invited many researchers to be trained in Japan, in Japanese universities and Japanese research institutes. And so there is quite a strong network among researchers across the region now. And actually we are kind of connecting these, human network, I mean the one institution to another based on the past experiences, and provide the initial seed fund for the joint research. And when actually their interests meet, they are going to kind of grow. And after they did a small project with our seed fund, they would go for looking for other outside funds together. So we are trying to provide the initial step for those institutions, but based on the past network, human networks we have constructed in our technical cooperation and university to university cooperation and human training for our provision of trainings, especially for PhD and also master's degree for in the medical areas. So utilizing the past experiences, we are trying to develop the new areas to focus for the both Japanese and ASEAN countries institutions. And the funding, I don't have really the simple answers.
Yes.
And as I said, we are struggling. We have committed in the past to widen our investment in the health sector in our official development assistance. So we are kind of sticking to it because it's our international commitment. So we try to secure that fund, although we are also responding to the arising needs from the current crises. But also we are doing our best to look for new kind of fund mechanism, like as Ken-san is quite aware that we are trying to mobilize a private fund, trying to have the joint partnership with private companies who are interested in ASEAN countries in health sector. There are quite some in Japan. And the important part is that we really have to be careful to be able to provide the services to the poorest also. So there's no magic formula which can simply provide funds to everybody. So the challenge is, of course, securing fund amount of volume, but also to direct in which way those funds, the fund coming outside of our official development assistance to provide, the basis for the universal health coverage. Thank you.
Thank you. Here in Washington, the Biden administration has come forward with a colossal package, a proposal, $106 billion that would be dedicated to the Ukraine war, to the Middle East crisis, to strengthening investments in Asia, and it's an eye-popping proposal, right? And there's not a lot in there on global health or global health security. And there's some development, but it's a deeply divided environment that we have here politically. And of course, we have instability within our governing institutions, particularly in the House of Representatives. So this bigger reality of these multiple crises is coming at a time where it creates enormous stress within our government. I think it aggravates a pre-existing set of crises that only expose further what we're looking at here. One of the audience members asked a question around what's the value of G20? What's the value of the G20? Asian leadership has played a very important role in the G20. Of course, with the Ukraine war, it's been complicated with the Russian engagement, China's engagement. What's the value of the G20, and how do we understand the G20 as against cooperation with institutions like the World Health Organization? Not that the G20 and WHO are the same. I think it would be useful, and we'll start with YY on, okay, what's the case? What's the case for the G20 from an Asia standpoint? How does it advance the common shared values? And then how do you see that as against the role that the WHO plays within Asia? Over to you, YY.
Thanks, Steve. So perhaps I could defer the comment on G20 to Madam Imoto or even Ken. They perhaps better placed than me to talk about G20. But I will talk about another regional bloc, which is ASEAN. And that is the collection of Southeast Asian countries. And we've always been of the view that actually some of the solutioning for the global health problems must be regional. Of course, WHO can set out global priorities and global best practices. But given the context specificity that we know applies a lot to public health policies and programs, actually regional blocs such as ASEAN, or even if I would use the African Union versus the European Union, you could start to see that the European Union, the African Union with the Africa CDC, they come up with solutions for themselves that are much more respectful of their local situation on the ground. And I think that it would be the same for countries in ASEAN as well, because that's exactly what we would see. I will use a very specific example. Could we have a regional bloc engagement with the pharmaceutical companies with respect to some of the essential vaccination? And are we able to negotiate directly with the pharmaceutical company as a bloc for ASEAN to bring down prices, to increase access? And actually, on the whole, it doesn't necessarily mean that the farmers will lose out in terms of profits, but because if this regional engagement results in greater access across the whole of ASEAN, actually the demand will go up, and the profit margin for pharmaceutical companies can actually increase as well. So it becomes a very viable solution. So I do think that the role of groupings such as ASEAN can actually provide very realistic solutions that are respectful of the local context in a particular region. Perhaps I could defer G20 to Madam Imoto and Ken.
Thank you. Maybe we could hear briefly from both Ken and Sachiko around what's the value proposition in your view for G20? What's the value proposition for WHO? Over to you, Ken.
For the G20 part, it's a check and balance for G7, and it's a wake-up call for G7, because G7 are basically democratic countries, and Ukraine situation made us realize that actually democratic countries are minorities in the world. Also, G7 countries, in terms of population, compared to the G20, a lot less. And so that, and where's the population growth coming? Not from the G7, but obviously the G20. And so to me, I think it's very healthy that there is the G7 because of the convening power I mentioned earlier, but at the same time, having a G20 saying, hey, you guys don't rule the world. We're here as well. And so that's, to me, that's the value of G20. WHO, I'll leave it up to Sachiko-san.
Okay, Sachiko.
Thank you. Of course, WHO is very important, regardless of many problems that the organization is facing. But they are the professional, and they are the one who are really observing or monitoring what is going on in the areas of health in a global stage. So they are important. There's no perfect institution. So all the time we really have to think about making it better. But they don't have the power to show the political will. I mean, to some extent, yes, but the political will is displayed in areas like G7 or G20. And as Ken-san said, G7 is a minority of the world. And it's not ruling the world. Of course, it should not be ruling the world. And of course, G20 is also still very limited. And when you talk about global south, it's very, very diverse. So no single country, neither China, neither India, neither South Africa or Brazil, no single country can represent the whole developing world. But still, they are important players, and they have the critical says, because they have a lot of partners in their surrounding areas, neighboring countries, or across the continent. So it's very important that we provide a place that these countries from developing world can have a great say in equal foot with G7 countries to provide their perspectives, how they look global health or security from their perspective, and what they can do from the developing countries. We need to have the ideas and solutions from those who are facing those problems. So I think it's very important that we have the political voice coming from developing countries, and on the equal basis that we can discuss. And the G20 has that, at least it provides one of such occasion. Thank you.
Thank you. We're getting towards the end of our time, and I wanted to close by coming back to you with a fairly simple question. I'll get to that question in a moment. We've covered a lot of ground. Our top topic here is really around the global health agenda. It's around coverage, universal health coverage, capacity building, human capacity, institutional capacity. It's about leveraging private sector engagement at a deeper and more enduring way. It's about the international diplomatic agenda that drives change and bridges common values and moves things forward. We know we're in a difficult moment. We know post-COVID, we have a certain amnesia and exhaustion that has settled in. And so people are oftentimes not all that inclined to reflect on what some of the tough lessons were from this profound and deeply damaging set of experiences. We know that we're in a period where trust is being stressed. And as YY has emphasized, we're in a digital era of pervasive disinformation and misinformation. And we're really at an early moment in trying to figure out how we deal with that reality and how we rebuild popular trust that's been stressed so much in this period. And then we talked a bit about the geopolitical crises that are upon us, whether it's US-China confrontation, Ukraine war, which is looking to be a long-term war of attrition at enormous costs. And now we have a Middle East crisis that's burgeoning and upon us, and we're not sure what that will all mean. So I think we've captured sort of the gravity of the situation and the challenges we face. My question to each of you is, in the midst of this, you are each dedicated to this agenda, and you're optimists and you're pragmatists and you're strategists. So what gives you in this moment the greatest hope? Like, where do you find the greatest hope and inspiration as you in this very difficult world that we're living in right now? I'm going to ask Madam Imoto to kick this off, and then we'll go to Ken, and then YY, you get the last word. You're going to be cleanup tonight. And so over to you, Sachiko.
Thank you. I am a practitioner, so I always get inspiration with the people involved in the real situation, working on the ground. And when I meet health workers, medical people, or the government people who are tirelessly working on the ground to promote, health for their community, it always gives me the hope that we can do more. And there are people, they haven't stopped. They are working tirelessly. And it's our responsibility to have the solidarity with them and work together. And we are, trying to preserve humanity, the health for all. It's a humanity. So, there are so many, the crisis, difficulty, fatigue, whatever. But those who are on the front line, they are working there still. So unless, there are the people who are trying to make the differences by themselves, I will never get, disappointed. Thank you.
Thank you. That's very, very eloquent. Thank you so much. Ken, your thoughts.
Okay, Steve, you promised a simple question, but not so simple. But I think human nature in complex situations, challenging situations, they always want the simple answer. Are you with us or are you not with us? Are you green or not green? But answers are never simple. And when you simplify things, if you digitalize everything, basically what it does is, I think it takes away from the human spirit. And to me, I think there's only one absolute that we all share right now, and that we're all going to die someday. That's obvious. And so what do we leave behind to our children, our grandchildren? Well, it could be money for some people, but there's question about equity. What can we all leave behind in an equitable way? And to me, that is celebrating the human spirit, never giving up on that. And as long as we have that, I think we'll get by.
Thank you. Thank you so much. Why you're delivering the benediction this evening here.
I can't do that, but because I have two very great panelists who have done very much better than I have. But I'll just highlight what gives me hope. And because I'm an academic and I see how the university, not just in Singapore, in Japan, and many parts of America as well, have actually changed in the way that they have approached global health. We talk about decolonizing global health, but I think increasingly there is a shift towards recognizing the importance of global health academic leadership. And why do I believe so much in academic leadership? Because we talk about capacity building and training. We talk about knowledge generation. Earlier on, Ken, you mentioned two phrases. You talk about knowledge implementation. You talk about the policy agenda as well. And I actually see all of this. Academics are coming together to move beyond what they used to focus on, which is publications and grants. But now they are talking about impact, they're talking about equity, they're talking about accountability. And I think this is very refreshing from an academic setting, because in the past, you don't hear that. But now increasingly, we hear a lot of that. And I'll just end off on this point. Political leadership in the world is getting more and more complex. But if within the academic sense and with the development agencies having that solidarity lens on it, I think the global health agenda can remain stable, can remain long-term, because you have academics that will look at what is important in the long term for a particular setting, that it's devoid from the political shift, the shift in political agenda and positioning. And that's what brings me hope. Of course, I would say that because I'm an academic, but I genuinely believe in that.
Thank you. Well, this has been a thoroughly enjoyable and rich session. I want to thank the organizers of this webinar and this series, Asia Undercurrent, and those are Nikkei and the government of Japan. Very grateful to both of them for this. I'm very grateful to our three speakers who have shown such remarkable leadership and eloquence and insights into these complicated topics from three rather different vantage points, I think. Three different perspectives, but it really made for a lovely conversation, a very rich conversation. I hope our audience felt the same way. I hope our audience will also go to the link to the post-webinar assessment, which is down at the bottom there, and share your thoughts on the quality of this and the benefits that you felt, and be very pragmatic The organizers of this are striving to continue to upgrade and improve. The next of the seminars will be on disinformation, which we touched on that topic today as a terribly important development for which we don't have great answers at the moment. So tune in soon when that is going to happen. So again, thanks to YY, to Sachiko, to Ken for such a great conversation and for your commitments and leadership in this field, and to our organizers. So, and very thanks to the audience that tuned in to be part of this, and thanks for your input in the question period. We're adjourned. Thank you all.